And amidst the rise in COVID cases and concerns over the new JN.1 strain, today the Health Ministry held a high-level meeting to review preparedness for COVID-19. Union Health Minister Mansukh Mandavia held the review meeting virtually with state health ministers to contain the COVID surge during Christmas and New Year festivities. All present for the meeting agreed that crowd management will be one of the main focus areas and the test, track, treat, vaccinate mantra will be followed.
इस मीटिंग में आज की कोविड-19 की जो सिचुएशन है उसका रिव्यू किया गया है। सेक्रेटरी साहब की तरफ से एक डिटेल्ड प्रेजेंटेशन उनके समक्ष लाई गई और ओवरऑल पिक्चर ये है कि देश में लगभग 2300 एक्टिव केसेस हैं। जो सिचुएशन मान लीजिए 1.5 महीना पहले थे उसके मुकाबले में बढ़ोतरी हुई है। पॉजिटिविटी भी कई जगह पे बढ़ी है। हमारे अस्पतालों की तैयारी, पीएसए प्लांट्स की तैयारी, क्रिटिकल केयर की तैयारी, प्रोटोकॉल्स की तैयारी और टीम्स की तैयारी पूरी होनी चाहिए। हमें सर्वेलेंस में ताकत और लानी है, ये उन्होंने रिक्वेस्ट करी है।
Now, India has witnessed an uptick in COVID-19 cases with 614 fresh infections recorded in the past 24 hours. Kerala, Karnataka, Tamil Nadu, Maharashtra and Goa have seen the maximum surge in the last 5 days and contributed to the overall surge. In the past 5 days, the fresh COVID cases have risen from 312 to 614 and are now at a 7-month high. With a rise in COVID cases in Kerala, the neighbouring state Karnataka has made masks a must for those above 60 years of age and with comorbidities. Karnataka has also increased testing for COVID-19 subvariant JN.1 and increased surveillance in districts bordering Kerala. Tamil Nadu has also increased RT-PCR testing in areas reporting fewer cases. In fact, even in Telangana, there have been masks that have been made mandatory for all in the public and issued an alert about the JN.1 subvariant to all public and private hospitals in the state.
You're watching the News Hour at 10, debate number 2 on Times Now, Super Prime Time.
And for more of this, let's go right across to our guest. Joining us is Dr. Naresh Trian, Chairman and MD of Medanta. With us also is Dr. J.A. Jailal. He's a former National President of the IMA. Dr. Sanjeev Bagai, Chairperson of DEFRAN, is also with us on the broadcast. Dr. Trian, let me begin with you. How big or how significant are you looking at, how significantly are you looking at this current spread of COVID? The JN.1 variant, as we know, has been spotted. There are cases across cities, across geographies that are now mushrooming. In view of the upcoming festive season in particular, how are you looking at this in terms of how it could potentially spread across India?
So this is a variant of concern in the sense that you see it has raised its head in the US. People are being hospitalized even in the US, and there are alerts out there for the public to go and get their boosters and things like that. Till today, what was reported to my knowledge, there are 21 cases of JN.1 that are reported in India. And there is a lot of people, because of the season, who do have colds, coughs, symptoms similar to COVID. But what is seen so far is that there have not been any serious consequences of that or complications of that so far. But I'm sure this is something we need to get extremely cautious about right away. And there has been a meeting at the government today also to keep a surveillance of where it's spreading and what are the recommendations that should be coming down the pike. So we are looking forward to that, to say what is the knowledge around the country, what is the incidence, how rapidly is it spreading, and what are the measures we need to put in place right away.
Right. But do you think that, common citizens would be interested in knowing one thing, especially those who are part of the traveling public would like to know, should they be masking up when they travel? Should that only be in a particular age category? Of course, the good news, as you rightly said, is that severe infections at the moment are reported to be fairly low. But would you still advise caution on part of those who have to, say, travel or attend some kind of public gatherings?
No question about that. I think that we have to go back to some of the measures we took during the COVID surge and anticipating that if it's still infective and it can spread very easily. So the idea is if you are elderly, if you have any comorbidities, even more so you need to protect yourself when you go in public places or you're traveling or in closed spaces where you may be. We got used to it now, traveling in planes, going to movie halls, going to weddings. We are just coming out of one of the most busy wedding season just now. Lots and lots of contact people had, and we are seeing that there are people who are not feeling, they think it's flu, they are taking the treatment for 2-3 days, and most of them are getting better. So the worst case we saw at Medanta was about a month ago, where we saw a patient who had never got COVID before. First time COVID infection, severe lung problems because he already had a pre-existing lung condition, and then had to be put on a ventilator, fortunately survived. But it took 3 to 7 days for gradually to get him off the ventilator and to send him home. So I think that there are serious versions of it, and especially the elderly and the children are more vulnerable. So I think it's time to do that distancing, masking wherever you're going into a crowded place, which is not known people. And I think that we should refrain from shaking hands and things like that, because lots and lots of people have colds, and that's how also by contact it spreads. Of course, it's airborne also. So distancing and not having physical contact is one of the most preliminary measures you can take even today.
Right.
Now, like I said, we are waiting for some advisories, since it is a variant of concern for sure, because you see China, there are many reports coming out of China that there is a mysterious lung problem. It could easily be this, and China doesn't reveal most of the situations that develop there. So I don't know. I think we have to err on the side of caution and get us protected right away.
Err on the side of caution. Very important advice coming there from Dr. Tran. But let me bring in Dr. Jayalal. Dr. Jayalal, the number of cases in Kerala has been the highest, and now we're looking at a situation where there are over 250 cases. What do you attribute this to? Is it because of a large amount of public that travels internationally? Is it about the weather conditions, the monsoon which has now retreated? What are you looking at in terms of the cause or the possible cause of these large surge in COVID cases?
Yeah, as you said, all those causes which we have mentioned are all true, because there is a monsoon season, there is a lot of festivities, seasons have started, people are now moving around quite a lot. But most importantly, they are testing a lot. But even if you look in the November 1st, their testing positivity rate was only 3%. But today, the testing positive was 30%. That means they have tested 560 samples, and 250 samples are testing positive for the COVID. That means the number of cases are more, the testing as they are also increasing more, that is spreading more. If you see now, this COVID virus is more of localized. In Singapore, in the last few weeks, it is rising exponentially. Last week, totally 56,000 people have been infected. And every year, their average incident is increasing by 7.5%. It is increasing. So Singapore is one localized area. Initially, we had with the China, first case in America. Now we are having an increased case in Kerala. We are talking that Kerala has first reported this case. But today, if you see even Delhi, Gujarat, we have on Maharashtra, 11 cases are being reported. That means there is an increased surge happening. The situation is relatively in interest area, because in the WHO says it is only the variant of interest, not even the variant of concern. Variants of interest means that we need to upgrade our testing facility. But today, most of the people think it is an influenza. When they get a cold, when they get a fever, none of them are coming forward to do the COVID test. And if we are going to do that COVID test, and also we are going to send a specimen for the genomic consortium, which India is doing, as Dr. Trigan has said, 21 cases at JN.1 positive has come. We need to be a little more concerned about this and cautious about upgrade our testing. But all other things, what Dr. Trigan has said about the cautious approach, whether masking or gapping distance, we need to be extremely implement that. This is the situation that we need to implement that, especially in the state like Kerala, where the Christmas, New Year season is going to be a big fun area for
Yes, and large gatherings is there as well as Goa that I expected. Yes.
There is a likelihood that is now there is a 23rd, 24th onwards, it will be a It is a huge crowd will be there. Unless we are cautious about that, we may miss the bus. So, I mean, it is a time that government should act very promptly and control and make control on all the massive gatherings. And if they massive gathering, there must be always they adopt the COVID principles they should follow.
All right. Social distancing, perhaps something of great importance. But let me also bring our viewers in, Dr. Bagai, into the other aspect, because we're looking at the National Capital Region, for instance, Dr. Bagai, where there's an early onset of winter. It is, of course, much colder than it perhaps normally is at this time of the year. We're also looking at the additional aspect of pollution and the people who are already suffering from various respiratory ailments. And if you add COVID to that mix, then perhaps people in this entire region need to be far more careful about the potential of being impacted or being infected rather with a new variant. Would you say?
Absolutely. Thank you, Madhav. I think it's a dangerous cocktail. It's the dipping temperatures, it's a relative change in humidity, there is smog and there is pollution. And then, of course, there is a common respiratory infections and a host of them, not only influenza, but respiratory syncytial virus, Coxsackie virus, and now this JN.1. And apart from that, of course, it's the Christmas, New Year's time. There will be get-togethers and close gatherings and so on. So I think, obviously, a word of caution. What is important to understand, Madhav, with your permission, if I take just 30 seconds to explain, is that JN.1 is a breakaway of BA 2.86. It was lying dormant. It suddenly latched on to what we call as a convergent mutant, which is LS455. That's your amino acid mutation, and it has become perhaps the most immuno-evasive mutation so far. What fallout of this is that even if you're triple vaccinated, you can get infection. There is a higher breakthrough infection, higher recurrent of infection, and the so-called hybrid immunity, because of immune imprinting, is dwindling. So the word of caution is that please wear a mask if you're going to the clusters, crowded places, poorly ventilated places. Keep adequate social distancing. 1 meter is not enough, a minimum of 3 to 4 meters, and avoid frequent handshaking, and of course hand hygiene is important. The highlighting feature of this clinically versus any other respiratory infection is new persistent cough and extreme fatigue and headache. These are the two things which have come out in the international news. So we need to be cautious. It's still early days in India, but I think it's better because we've learned from past experiences that Delta took us by storm. Omicron is a milder variant, but let me add the R0, that is the infectivity of this, is much more than the parent BA.2. So we need extreme public health measures to be put in place. No panic, but I think caution is the word. Mask will still prevent a majority of infections, not only COVID, but any other respiratory infections. Remember, Omicron is also airborne. It's microaerosol. It can go up to 60 feet. Keep safe distance.
Right. Dr. Trian, I wanted to draw your attention, I'm sure you would be aware of this, between the 4th and the 10th of December, in Singapore, for instance, we've seen a recorded 56,043 cases of this particular variant that is being reported. Now, this is, of course, a very significant number to be reported for just one city, town, as it were, one country town, as it were. And therefore, it is certainly something that our policymakers should draw lessons from, would you say?
No question about that. Like I said, when you say a virus variant of concern, that means that we need to trigger the measures that all my two other colleagues have said right now. And that is the main thing, that we are actually, as I said, coming out of the wedding season and going into celebrations for Christmas and New Year. And there will be a lot of sort of crowded areas in small halls and things like that. So I think to protect yourself is the best thing you can do. And like Dr. Bagai said, Dr. Jadal said, distance, masking, don't have hand contact, and then keep 2 meters at least, if not more. And that's the mantra you can do for yourself. Now, like I said, there are some policy decisions which will come down the line in the next day or so, I hope. And then we will know exactly what should be put in place, even by the recommendation of the ICMR and government. So this is something that we need to track very closely. I'm glad you're doing this program, and we should be able to alert the people that, like, if there is concern.
Absolutely.
Alarm, panic is a word which keeps getting played around.
Absolutely. And in fact, let me put that question across to Dr. Jailal. Dr. Jailal, there are many who will question whether we've learned the lessons from the past wave, the second wave, for instance, which caused havoc, I would say, in many cities and many regions of the country. Are we prepared? For instance, the infrastructure availability, the availability of oxygen, all of those problems that we've gone through about 2.5 years ago. Have we learned those lessons is a question that many would ask. Are we properly prepared to deal with any eventuality?
Yeah, I think so, because the government is very serious on that. The health minister has already started a talk with all the state. He has already sent an instruction to the state to do that. Every state has instructed the medical colleges and people to see that the infrastructure, ICUs are kept ready, oxygen is kept ready. And most of the centers, we know, not like what the second wave we had, where there are a lot of problems with oxygen. Now, most of the hospitals, as the oxygen generating capacity has been increased. So I'm sure India is one country where we are confident about our managing this situation. Fortunately, thank even the JN.1 is not going to be a very serious infection like a Delta wave or the initial waves we got. It is going to be a mild infection. Only thing is the transmissibility will be more. More and more people are going to be infected. And it is the 3 people have died in Kerala. All are having associated comorbid conditions also. So the people who are really having a comorbid condition, they need to be a little more concerned. People, if they have not put their vaccine, though it has an immune escape, but definitely the vaccine is giving a lot of protection against a severe infection. That we should do. India is one country where we have seen the dual vaccine, our vaccination, the booster dose has been achieved by 90% of the people. So we are in a prepared state to control. But if we can do one area where we are failing, we are good in managing the COVID case. Preventing the COVID case, we need to take little more step. Right. The government should control the massive gatherings, and the strict rule should be there. When there is a massive gathering, they should get the special permission with the government, and they should adopt the COVID etiquette and COVID principles should be followed. And if the government can take the machinery to see to that, the prevention can be also done, and definitely that India will be able to face this situation, and even any eventuality happens. As on date, the government is on the move. Right. The people, the healthcare professionals are on the move, and we are prepared to face the situation. And we will definitely do the maximum best for the country.
Okay, Dr. Bagai, you know, the one thing that if you ask any common man, when you say the word COVID, the next thing that comes to mind immediately is lockdown. How close or far are we away from an actual lockdown-like situation happening? What do you say?
Okay, so 2 important points in this, Madhav. I don't think we are anywhere close to a drastic measure of a lockdown. Remember, a lockdown is always done at the initiation of a pandemic, basically to get the government machinery ready and to sensitize such a large community like India of 1.4 billion. So I don't think it's going to be a lockdown. There will be guidelines and there will be certain restrictions, and I think that is sensibly so. I want people to understand that people who've been vaccinated in India, almost 95 to 96% of the adult eligible population has received the double vaccination. A vast majority have also been triple vaccinated, would have developed a reasonable amount of immunity. Although this virus escapes it 210 times in terms of neutralizing antibodies, but there is a large amount of binding antibodies and T-cell reactive cells which will still protect you. Right. Yes, there is an updated XBB 1.5 vaccine as a bivalent vaccine internationally, but at the present moment, I think simple measures would be able to control festive season, close gatherings, especially in close crowded places. I repeat, poorly ventilated places, because the only way which you can prevent this virus is to have a proper ventilation system, should be a safe way forward. It's better to wear a mask than to have a tube down your throat.
Right, absolutely. I think that's a very, very sane piece of advice. It's better to wear a mask than have a tube down your throat. But Dr. Tran, very quickly, almost out of time, is there need for fresh vaccination, or those who have been double vaccinated, would you say that today they are protected enough? Because there's a lot of debate about how long the effect of these vaccines last. Dr. Tran.
You know, there are two parts to it, where we say there are antibodies and there are T-cell immunity. So people who have been vaccinated fully, they should have enough residual T cell protection. And unless you are actually have severe comorbidities like severe ILD, like lung problems, or renal failure, or liver failure, those are people who need to be protected more than the general population.
Right.
And also said that the other category is the elderly people who will not be able to withstand even a small or short bout of fever and body ache and things like that. So I think we have to calibrate it according to the person. But in general measures, everybody should take.
All right.
There's nothing wrong. We got used to for almost 2 years, we were wearing masks.
Absolutely.
It did help us, all of us. So I think that there should be no hesitation that if you're going in, especially in a crowded place, it's better to wear a mask and not be immersing yourself in large crowds in poorly ventilated place, especially. And like you say, today the weather is such that the cold air is settled down, and it is always around when people are together tightly packed, whether even when they're open. The amount of virus that can be emitted and the lack of circulation of air, natural circulation, there is no wind or something like that, you can have problems. So be extremely cautious. It's a matter of 1 or 2 weeks, and hopefully we can defeat it even now in the early stages and not be careless and then suffer the consequences as we go further.
Thanks so much, Dr. Trian, for that, Dr. Jailal and Dr. Bagai. And you heard it there, ladies and gentlemen, 3 of the country's top doctors who are giving you advice. There's no cause for panic, but there is enough reason to take precautions if you're traveling, if you're attending public functions, if you're going to be in the midst of a crowd, or if you have severe comorbidities or are a senior citizen, then you certainly need to be that much more careful. And perhaps if there are adequate precautions taken, then we can defeat even this wave, if I can call it that, or at least this variant of the COVID virus. Thanks so much for joining us this evening.